Hi everyone, my name is Dr. Nkendong. I am a psychiatric nurse practitioner. I also hold a Doctor of Nursing Practice degree. Why are second-generational antipsychotics preferred over first-generational antipsychotics? Before I go any further, I would like to say this information is intended for educational purposes only and is not a substitute for professional medical advice. Always consult your healthcare provider before making any medication or lifestyle changes. First-generation antipsychotics such as haloperidol and chlorpromazine are characterized by their high affinity for dopamine D2 receptors. By blocking these receptors, first-generation antipsychotics primarily mitigate positive symptoms of schizophrenia, such as hallucinations and delusions. The challenge with first-generation antipsychotics lies in their limited receptor specificity, leading to significant dopaminergic blockade in various neural pathways, subsequently manifesting as a spectrum of extrapyramidal side effects. In contrast, second-generation antipsychotics, represented by medications like risperidone and clozapine, exhibit a more nuanced receptor interaction. Besides the dopaminergic system, second-generation antipsychotics modulate serotonergic, adrenergic, and histaminergic receptors, contributing to a broader therapeutic efficacy and a diversified side effect profile. This heterogeneity in receptor engagement is central to second-generation antipsychotics' ability to address both positive and negative symptoms of schizophrenia while attenuating the risk of extrapyramidal side effects. Now, let's examine the side effects of antipsychotics. 1. Akathisia. Akathisia, a profound state of inner restlessness and incessant movement, is intricately linked to dopaminergic blockade. Addressing akathisia necessitates a multifactorial approach such as reducing the antipsychotic dose, considering alternative agents with lower akathisia risk, and adjunctive treatment with beta blockers, benzodiazepines, or anticholinergics. 2. Parkinsonism. The manifestation of Parkinsonism in patients on antipsychotics is a direct consequence of dopamine antagonism in the nigrostriatal pathway. Management strategies necessitate a meticulous reassessment of the therapeutic regimen, dose reduction, transition second-generation antipsychotics as or incorporation of anticholinergic medications such as benztropine. 3. Dystonia. Dystonia, characterized by involuntary muscle contractions and abnormal postures, demands acute intervention. Common features of dystonia include ocular gyrate crisis, which is a sustained decontraction of eye muscles, and torticollis, which is a sustained contraction of the neck muscle. Rapid administration of anticholinergic agents like benztropine or diphenhydramine is imperative to alleviate. 4. Neuroleptic malignant syndrome. Neuroleptic malignant syndrome, a rare but life-threatening condition, is characterized by hypothermia, autonomic dysregulation, altered consciousness, and muscle rigidity. The management of neuroleptic malignant syndrome is a medical emergency, immediate discontinuation of the antipsychotic, intensive supportive care, and consideration of dantrolene or bromocriptine as therapeutic interventions. Clozapine, a second-generation antipsychotic, stands as a therapeutic option for treatment-resistant schizophrenia. However, its use is tempered by the risk of agranulocytosis. Rigorous hematological monitoring and a patient-centered approach to managing metabolic disturbances and weight gain are paramount. Second-generation antipsychotics are generally preferred over first-generation antipsychotics due to their more favorable side effect profiles and broader therapeutic applications. Second-generational antipsychotics exhibit a more diverse receptor binding affinity, interacting with dopamine, serotonin, histamine, and adrenergic receptors, which allows them to address both positive and negative symptoms of schizophrenia and reduces the incidence of extrapyramidal symptoms. Negative symptoms of schizophrenia, such as social withdrawal, lack of motivation, and blunted affect, are often more debilitating than the positive symptoms, and second-generation antipsychotics have demonstrated efficacy in managing these, providing a more holistic approach to treatment. Additionally, the reduced risk of extrapyramidal side effects such as akathisia, dystonia, and Parkinsonism with second-generational antipsychotics contribute significantly to their preference, as these side effects can severely impact the patient's quality of life and adherence to medication. Another aspect is the metabolic side effects. While second-generational antipsychotics do have metabolic side effects such as weight gain, hypolipidemia, and increased risk of diabetes, these are often considered more manageable and less distressing to patients compared to the motor disturbances associated with first-generation antipsychotics. Antipsychotics are indicated for a variety of mental health conditions beyond schizophrenia. They are integral in the management of bipolar disorder, where they can help stabilize mood and prevent the recurrence of manic or depressive episodes. In addition to schizophrenia and bipolar disorder, antipsychotics are also used off-label in the treatment of severe anxiety and treatment-resistant depression, certain behavioral disorders in children, and agitation and aggression in dementia. In conclusion, the preference for second-generation antipsychotics stems from their ability to treat a wider range of symptoms, reduce incidence of distressing extrapyramidal side effects, and their application in treating various mental health conditions. While challenges remain, particularly in managing metabolic side effects, the advancements represented by second-generational antipsychotics have led to improved outcomes and quality of life for many individuals living with mental health disorders. Thank you for watching. Don't forget to subscribe to my channel for more educational videos.